So allowing yourself to find a comfortable position on your back, with your knees straight and your hands out to your sides. Connecting into your breath and allowing yourself to notice what areas of your back body are supported on the floor. Notice what areas are touching the floor and which might be hovering above. Allowing yourself to notice where your breath reaches in your body. Are your breaths shallow or deep? Can you feel your belly rise and your ribs expand? Allowing yourself just to be curious of how your body is resting in time and space. The goal isn't necessarily to adjust. However, if you need to adjust, listen to your soma and do so. Moving your focus now down into the soles of the feet. The backs of the feet where they're resting on the floor. Noticing if your toes are pointing up to the ceiling or out to the sides or inwards to each other. Noticing if one is different than the other. And moving up through the calves, noticing if there's tension or holding. Through the knees and the backs of the thighs, up into the glutes and the hips, noticing if one feels more weighted into the floor than the other, or higher. If your one leg feels longer or shorter. Noticing if you can sense into your tailbone, all the way to the tip of the coccyx, all the way up the sacrum. Just noticing off of that bone into the muscles of the glutes. If there's tension, if there's holding. Moving up the spine into the lower back. Noticing how the spine and the lower back feel. Is it flat to the floor? Is it arched? Is one side flatter and the other side more arched? Noticing if the hip feels like it sits higher on one side than the other. Moving your focus now up your spine a little further into the thoracic, into the rib cage. Noticing from one side to the other if there's more weight. If it connects to the floor more. Moving up a little further into the shoulder blades. Noticing if one feels sharper into the floor or higher, moving up into the traps and shoulders. Noticing, are they close to your ears or are they neutral? Moving your focus to the front body, feeling in through the chest and the shoulder girdle. Are your shoulders down to the floor or up to the ceiling? Is there space in the chest or is it tight and closed? Moving down through the sternum, the center of your front body, and noticing in through the ribs on either side, noticing if one feels higher than the other. Moving into the abdomen and all the way down to the pubic bone. Noticing if there's any tension or tightness in your abdomen. Noticing in through the front of the hips, the hip flexors. Is there tension? Moving into the quads, the big muscles of the legs. Just allowing yourself to notice. Down through the shins and the top of your feet. Moving now back up into your neck and shoulders, noticing the neck, the throat, the sides, the back of the neck, and how the head is resting on the floor. Noticing if there's tension through your scalp or through your brain, through the front of your face, your ears, your lips, your eyes, your nose. Just noticing. Now drawing your attention out to your arms, from the shoulders, noticing any tension in the joints. Down through the arms, noticing where in time and space they are. Are they resting on your body or beside your body? Are your palms up to the ceiling, in towards your body, or down towards the floor? Noticing where there's any tension, all the way to the fingertips, through the palms and the backs of the hands. Just bringing your awareness in. This, for today, is your baseline. Allowing yourself to come back to your breath. As you breathe in and out, just allowing yourself to notice. It may have even changed since we've gone through this Soma scan, as we've paid witness to our system. When you're ready, I invite you to bring your knees up to the ceiling so your feet are flat on the floor. Allowing yourself to play with the position where your feet are in reference to your glutes. See if today it feels a little different or better or more easy. Looking for the ease in our system. Whether the feet are closer together or farther apart, closer to the glutes or further away. Just allowing yourself to see what feels right for you today. This is your time to be curious and really give your body the opportunity to do things different, to let yourself notice patterns. And in any of the movements we do today, if there are any pain, I invite you to stop, rest, allow the system to reset, and proceed in your next movement after a breath or two in a smaller capacity. Our objective is to do things differently. We do not want pain. So if there is any, we're going to stop, rest, breathe, and start again slowly. Taking a moment here on your next inhale, thinking about your belly button rising up to the ceiling, which will create a gentle arch in your back. Tip of the tailbone will go down, and breathing out as you get to neutral, a gentle contraction in your abdomen will flatten your back to the floor, tilting your tailbone up to the ceiling. Continuing this breath, belly button in, out, tip of the tailbone down. Allow yourself to soften through the neck and the shoulders, breathing at your own pace. Seeing if you can notice more movement through the shoulders, the neck, and the head as the spine flattens as you exhale and lengthens, and shortens and arches on your inhale as your belly button goes up. Allow your whole body to be present in this tilt and flatten breath movement. 2 more breaths here, full cycles at your own pace. Watching for what we call as sensor motor amnesia. It can happen in any movement. It is when you're doing a movement and you're moving out of it with slow focus, you have glitches or jumps in the movement. And if you do, stop, recontract, and take it through again. Take it through that movement. We don't want to repeat patterns where there is missing information. So bringing your breath just to a natural rate and rhythm. And allowing yourself to notice what you notice in your body. And when you're ready, I'll have you lengthen your legs long. And taking a breath or two here. And when you're ready, we're going to do knock-kneed. So we're going to think about utilizing both legs at the same time if it feels right for you. Adjusting the yoga mat out from underneath the ankles and feet so your feet can glide with ease. Listening to the side that has the least amount of movement and going only as far as that side on both sides. So often we'll notice that we might have more of a range with one side. We're going to just move to the lowest common denominator. So thinking about both legs at the same time, internally rotating from the thighs. So your knees will go in together. When you reach a point, you may notice that your knees will bend and your feet may arch up along the outside, drawing along the floor. And if you're able, when you get to the top point, allow everything to soften as much as it can. Rest there a moment. And slowly, with control, bringing your legs back to neutral. Remembering we're just going to the leg of the lowest common denominator. And if doing them both at the same time is too much, One at a time is perfectly okay. When you're back at neutral, allow everything to soften and everything to rest, taking a breath or two here. And when you're ready, slowly internally rotating from the thighs, in the hips, being mindful of any muscle contracture where it feels like it's going to spasm. That is likely that you've gone too far. Slowly, with control, releasing it all back down to neutral. Watching for any sense or motor amnesia. If there is that glitch or it speeds up at all, slowly recontract before the glitch and move it through with control. And when you are back at neutral, a breath or two here, allowing every muscle that got engaged all the way through your system, allowing it all to soften, rest. And when you're ready, last time, again going only to the lowest common denominator, seeing if you can notice the change in your hips as you rotate inwards. Can you feel the space in the glutes? And slowly, with control, bringing it all back down to neutral. When you're at neutral, allowing everything to soften, all through the legs, the glutes, the pelvic floor, the abdomen, even up into your eyebrows. After your breath or two, we're going to do the bow-legged, which is external rotation from the thighs. As you do the external rotation, again, only going to the lowest common denominator. Your thighs will externally rotate, and when you get to a point, your feet will start to glide along the floor, coming together, the soles of the feet. They may move up the floor closer to your body. When you get to the end point, if you can, just rest there a moment. And slowly, with control, bring your body back to neutral. Slowly extending the legs, watching for any sense or motor amnesia. Recontracting if there is, and taking it through the movement. And slowly all the way down till the feet rotate flatly so they're on their heels in neutral. Taking a moment when you get to neutral. To allow everything to soften and everything to rest. And when you're ready, again, allowing the bow leg motion to occur again, externally rotating from the hips. The soles of the feet will come together and you can glide them up on the floor, closer to the glutes, resting at the top position for a moment. And when you're ready, bringing the legs back to neutral, watching for any sensor motor amnesia. It can sometimes be a little hard to tell if the feet are gripping on the floor or the mat. But do your best to be curious. Recontract where necessary. When you are back at neutral, allow everything to soften, everything to rest. Last time with this one, into the bow-legged, so externally rotating from the thighs. Notice that the glutes engage, and it's almost like the sacrum, you can feel the muscles along there get a little tighter. And slowly bringing the legs out into full external rotation. Slow with control, and when you reach the top position, allow your body to rest there a moment, and slowly with control, taking the legs out to neutral. Taking your time to listen for any sensor motor amnesia. And when you're at neutral, allowing all the muscles that got engaged to soften and rest. And allowing yourself just to notice if anything's changed, from the tips of your toes to the tip of your head. Just noticing. And adjusting the hips and the pelvis if necessary. I'm going to move into a hip rise. Starting on the left, we're going to shorten the sideline between the hip and the armpit. And do a hip raise. So that left leg will shorten, and you might notice the right leg go longer. Your arms can be positioned by your sides or up, clasped behind the head. See where your position you would like to be. Slowly with control, bringing that left hip back down to neutral. When you get to neutral, starting to gently engage that right hip, shortening that side body line between your right hip and your right armpit, rising your right hip up. You'll notice that right leg get shorter and the left leg get longer. Once you're at the peak, slowly with control, bringing it back to neutral. Notice if you can notice when neutral happens, feeling the shift of the weight through the glutes, and contract and hip raise the left hip. letting the legs move freely, slowly at your own pace, watching for sensory motor amnesia. Move from the left to the right hip in the hip hikes. Doing 3 times on each side. Feeling the shift of the tailbone. If you can. Notice, can you feel the muscles along the sides shift and contract and relax? The muscles through the back engage. All the way up to the shoulders, you might notice. Once you've done 3 on each side, allowing all the muscles that got engaged to soften, rest, and relax. And when you're ready, I'm going to have you bring your feet flat on the floor so your knees are pointed up to the ceiling. I'm going to reach the right arm up and above our head, resting on the floor, wherever it is comfortably. I'm going to think about reaching to the wall that the fingers are pointed towards. So lengthening that arm as we gently tilt our knees to the left. Going only as far as is comfortable. Notice if you can notice a gentle opening or pull in through the armpit. And slowly with control, watching for sensor motor amnesia, bringing the legs back to neutral and soften the arm. Again, being mindful that small movements are beautiful. We appreciate them and we can move from them into bigger movements. So remember, less is more. When you're at neutral, allow everything to soften and everything to rest. You might find it comfortable to have a pillow under your arm if your pecs are tight, just to support your system as best as you can. When you're ready, slowly reaching along the floor with that right arm and slowly drifting the knees to the left, only as far as is comfortable. Remembering less is more. It's all about how controlled and slow can we bring those legs back up to neutral, watching for sensor motor amnesia. If there is any, rewind the movement and start again just before the sensor motor amnesia. As you fine-tune your senses, you might notice sensor motor amnesia in particular areas of the body that are working to do this movement. And of course, when you're back at neutral, allow everything to soften, everything to rest. And last time on this side. Giving your arm a break whenever it needs. Gentle reach up with the arm and slow drift to the left, a controlled drift to the left. Slowly with control, bringing the legs back up to neutral. And when you're at neutral, allow everything to soften, everything to rest. After a breath here, bringing your left arm up and above, resting on the floor, thinking about stretching that left arm. Stretching that left arm up to this wall that the fingers are pointed to, and slowly drifting the legs to the right. Slowly with control, bringing the legs back to neutral, watching for any sense or motor amnesia. When you get back to neutral, allow everything to soften. Everything to rest. Remember to rest that arm in its stretch. Or I should say in its reach, because we're not stretching, we're moving. After a breath here, when you're ready, gently reaching with that left arm and slowly drifting the knees to the right. Remembering that less is more. When you've reached your end, slowly with control, watching for any sense or motor amnesia, bring the knees back up to neutral and allowing that arm to soften its reach as you do so. And when you're at neutral with both, allow a breath, remembering though to breathe all the way through the movement, allowing everything to soften and everything to rest. And when you're ready, last time on this side, gentle reach with the left arm along the floor, drifting knees to the right, and slowly with control, bringing your knees and your arm back to neutral, watching for any sense or motor amnesia in either of the arm or the legs movement. Honoring any sense or motor amnesia, recontract. And bring it through all the way back to neutral. When at neutral, allow your arm to find a comfortable position, allowing everything to soften, and everything to rest. Taking a breath here. So allowing our arms to rest wherever they are comfortable. I'm going to leave the knees pointed up to the ceiling and the feet flat on the floor. Just taking a breath or two here. And allowing ourselves on our next inhale, we're going to do the tilt and flatten. Seeing if we can be soft through the spine, the neck, the shoulders, the hips, the pelvis. As we breathe in, that belly button rises to the ceiling, back gently arches, tip of the tailbone down to the floor, breathing out. When you get to neutral, gentle contraction as the back will flatten on the floor and your tip of the tailbone will rise up. It's almost like you're bringing your pubic bone a little closer to your ribs. Breathing in, lengthening the space between the pubic bone and your ribs. Belly button up, breathing out. Pubic bone and ribs come closer together as you consciously contract the abdomen. Breathing in, breathing out. Breathing in, belly button rises. It's like the whole front body gets a little bit longer. Breathing out, it's like the whole back body gets a little bit longer. Breathing in, whole front body gets a little bit longer. Breathing out, full back body gets a little bit longer. Next one, just at your own pace, 2 more breaths here. Thinking about that belly button up. Let yourself notice, does the nose move? Does the neck move? Does the shoulders move? Breathing at your own pace. Consciously as you exhale, contract as you get to neutral. And when you've finished your 2 cycles, just allowing your breath to go back to its own rhythm, its own pace. And allowing every muscle that got engaged to soften and relax and rest. And when you're ready, I invite you to lengthen your legs. And resting your hands wherever feels right for you. Noticing how your breath might feel different than it did when we started this Soma scan, when we started this session. Allowing yourself to notice the differences from the baseline that we gathered at the beginning of today. Moving now to the soles of your feet and your heels, noticing if they are resting differently on the floor than they were when we started. Noticing all through the back body. If you notice more areas of your body connected and supported by the floor. If you are able to notice more areas of yourself resting on the floor than when you did the scan at the beginning, that is a wonderful thing. That is a sign that your body has let go. You have now changed some of the holding patterns, some of the tension patterns that were existing in your body. Moving your focus now back to the backs of the calves and the knees, up through the hamstrings. Just noticing how the tension is different than it was before. In through the glutes, tailbone, sacrum, right to the tip of the coccyx of the tailbone. Noticing if your hips feel wider and softer. Moving your attention into your lower back, the muscles of the lower back. Noticing if your back is resting closer to the floor or how it is different than it was before. Moving up into the hips, noticing if one feels more aligned with the other, more different than when we witnessed it the first time. Noticing if one leg feels more aligned, more of equal weight as the other. Do the legs feel more equally balanced, equally long? Moving up through the back body, into the ribs, into the thoracic. Noticing as you breathe how the ribs feel different than they did before. Moving your focus up to your shoulder blades. Noticing if they feel more balanced on the floor. Or notice how they feel different than they did when you witnessed them the first time. Moving up into the shoulders, noticing if they're further from your ears than they were before. Does the chest feel broader and softer? Do the shoulders rest into the floor with a little more ease? Moving down through the sternum and the front ribs, into the abdomen. Allowing yourself to notice what you notice is different. In through the hip flexors, front of the hips, down through the quads, the big muscles of the legs, the knees, the shins, all the way down the front of the feet. Just noticing what is different. Moving now up into the neck, head, and chest. Noticing the difference through the sides of the neck, the front, and the back. Noticing how the head is resting differently on the floor. Noticing through the scalp and the brain, the ears, the eyes, the mouth and jaw. Noticing the changes that your body has made today. Taking your focus now back to your breath. Again, just noticing how it is different. Is it deeper than it was before? Is it easier to breathe? Wonderful witnessing. And when you're ready, I invite you to allow yourself to lay on one side or the other. And slowly, at your own pace, allow yourself to come to seated position. Taking a moment to give yourself thanks for witnessing and working with your body in this way, allowing an opportunity for change and giving yourself time and space to be within. Thank you.